Assalamu alaikum, hello and welcome to another episode in our second series of The Health Show, here only on the Islam channel with me, Alistair Greener. Every week we're joined by a health expert within their field of expertise, and together we discuss different ways of preventing and treating health issues or concerns that we or our loved ones may face. Now, many of these issues are caused by an unhealthy lifestyle or a lack of knowledge when it comes to seeking professional advice. So that's why we're here, so you can become better informed regarding the various health issues that we discuss with our experts here on the show. And hopefully you'll be able to change your health or lifestyle for the better. So if you'd like any further information on any shows or topics that we discuss, please do get in touch. healthshow@islamchannel.tv. Now, we must stress that should you suffer from any medical problems or have any concerns, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health topic being discussed. Now it's time to get into today's show, where we're going to discuss the biggest trends in the world of cosmetic surgery and in particular facial treatments. It's a great pleasure to welcome Dr Chia Tan, who is the founder of Harley Street MD, having been trained in the UK as a medical doctor specialising in cosmetic medicine. Probably the best way to introduce him and his services is by watching this video. So let's take a look.
Welcome to Harley Street MD. My name is Dr Tan. I'm the founder of Harley Street Medical Doctors. We are located at 90 Harley Street, Central London. We are close to both Oxford Circus and Regent Park Tube Station. I'm a member of the Royal College of Surgeons, the British College of Aesthetic Medicine and the Royal College of General Practitioners. I'm a GMC registered doctor and I have been practicing medicine for more than 15 years. At Harley Street Medical Doctors, we offer bespoke non-surgical procedures such as tear trough treatment, lip enhancement, 8-point facelift, chemical peel, and medical skincare. The ethos of my clinic is to achieve both facial symmetry and a natural looking result. We specialize in correctional procedures such as nose and chin reshaping for clients who have, for example, a nasal bump or a retracted chin. For patients with stubborn area of fat, we have a variety of procedures that can help you, such as Aqualix injections or the latest 3D Ultimate machines using fat freezing therapy, ultrasound cavitation therapy, or the radio frequency skin tightening therapy. Another machine we have is the Plasma BT machine, which is a second generation plasma machine for non-surgical blepharoplasty. It is extremely effective in tightening upper eyelid area. So why choose us? At Harley Street Medical Doctors, we offer bespoke aesthetics, individualized procedure to achieve facial symmetry using the latest technology and cosmetic technique. The clinic is CQC registered and all the doctors are GMC registered. We provide professional consultation and create complete treatment plan tailored to you. We go through every detail, addressing any concerns that you might have. We also provide comprehensive aftercare services to ensure you're completely satisfied. Just remember, at Harley Street Medical Doctors, we are a friendly team. We are here to help you to look good and feel good.
Well, that gave us a good idea of what you do. I mean, so much there. But first of all, I'd like to know, what's the difference between cosmetic surgery and non-surgical treatments?
Yeah, cosmetic surgery basically based on operations. So you'll be going to theatre and then the surgeon will basically plan out the procedures they want to do and then carry out the procedures. And non-surgical wise are basically using Botox, fillers, those treatments are actually more temporary and to correct any issues that we have without any operations. So the downtime is so much more less and then the cost is so much more less as well.
And one of the things I've noticed there, you were talking a lot in the video about second generation machines and this incredible technology.
Yeah.
Many of us have impressions of cosmetic surgery involving scalpels and knives and scars, and quite put off by that prospect. Give us an idea of how much cosmetic surgery has changed over the years.
Oh, it's been changed so much more nowadays. The actual surgery itself is so much more advanced, and then we don't really see those big scars anymore. So scars are very, very minute, and they're actually being hidden away from natural creases. And a lot of the time we don't have to do like a full facelift anymore. People who do facelift can have mini facelift or just neck lift, things like that. And non-surgical point of view is so much more flexible. We can do a lot of things. We can actually tweak certain stuff. We can even dissolve things that you don't like. So you will have a say during the procedure. So it's not as in surgery that you'll be put under anesthetics and then you may not know what's happening after. But non-surgical is very much different. So you'll be actually communicating with a doctor. You'll be actually have a say in what you want to.
It's fascinating to hear the subject and hear some of the things you do. Now, of course, for many of our audience, as part of their faith, they won't want to change their appearance on a cosmetic basis, but there are sometimes accidents that people have or other reasons. So give us some of the main reasons why somebody might come to you.
Yes, sometimes people have an accident playing sports and then they basically fracture the nose, and then the nose may not look that straight anymore. It may affect their self-esteem or even their career progression, or depending on what they do as well. And that sometimes can quite be easily fixed with a non-surgical technique, just straighten out the nose. Or even someone who has quite severe acne when they're teenagers and then left with lots of acne scars or pigmentation issues, that certainly can be fixed as well non-surgically.
Yeah, that scarring is something that can be quite a common thing, I can imagine, because of maybe accidents or, as you say, acne
certainly.
and things like that. How straightforward is the removal of scars these days?
We basically go for a very natural way of doing with that, and you can have microneedling. We can inject certain stuff to just basically plump out the area and then make it less visible to normal visual light, and that can be done. And of course, if it's a very big scars, then it might have to be done surgically, like removal of scars, so that the scars will be much more minimized and less to be seen in appearance point of view.
And what about the difference between men and women? Because you know, we hear a lot about women having surgery or having treatments, but actually men do it, but maybe a little bit more on the quiet. What is the proportion between male and female?
Actually, there are quite a lot of men coming for treatment. I would say probably 70% women and 30% men, and men are more open to non-surgical procedure nowadays, and probably because of social media exposure and less of a stigma anymore, and they know about the procedure, and probably quite a lot of mates that probably are having that done as well. So.
And looking particularly at women, you say 70% of your clients are women.
Yeah.
Obviously, again, many of our viewers will be concerned about maybe male surgeons, about covering up and things like that. How do you overcome those issues?
Yeah. We generally only need to have exposed area or where we need to work on. So people wear headscarf, they don't really have to remove everything, simply actually just on the area that we really need to work on. So probably just quite far back to the jawline, so they don't really have to remove everything. Actually having the hair being covered is actually quite good for us as well, and actually reduce risk of infection during the area.
And if you have your female clients who particularly would prefer someone to be female performing the treatments, is that possible?
Yeah, it is possible, and so, of course, someone, if they prefer the female to do the procedures, certainly that can be done as well. And of course, if they need to have someone there, like a chaperone, that can be done as well. Yeah.
And what are the biggest areas of treatment these days? What are the most popular concerns that people have?
And of course, we have the usual Botox for forehead or the lip enhancement. Personally, in my clinic, the best treatments, the number one treatment, actually something called tear trough treatment. And it's basically having a filler and basically restoring the volume underneath the eye. And because with age or even sometimes genetic, you can have some sort of like a hollow underneath the eye, and then that makes people look a bit more tired. And everyone just want to look more refreshed. It's not about having bigger lips or anything like that. It's really just want to look more natural, look what they had before, and just make them look more refreshed. And so that's actually the #1 treatment.
You're making me feel quite self-conscious about my own face and body here. But of course, many men are coming to you for different types of treatment. You talked there about the tear areas and everything. Is that the same for men, or do men have their own specific requests?
Men as well, actually. Men do have the tear trough treatments as well. That's why it's quite popular between both gender. But men also have sometimes not about lips or anything. They do have different things. So sometimes simply having just a refreshment of the face area, like a light chemical peels, just to freshen up everything, that can be done. Or sometimes just making the facial features a little bit more muscular, a little bit more attractive that way. So it's very much different between men and women, how we progress to that.
I'd like to get into the nitty-gritty here of what exactly you're doing. You're talking there about face peeling and things like that. What exactly is that?
Face peeling, basically, in a very controlled manner, you use some acids, and then these acids, of course, are very much like CE marked, FDA-approved acids in a very controlled manner done by the physician. So you can basically peel very superficially, or medium peel, or deep peel. So that can basically get rid of some sort of like a dead skins on the outside, so the skin will be smoother. If you go deeper, you can get rid of any pigments, uneven pigments on the skin, or even just lighten up smooth out any fine lines on the face as well.
And is it painful at all? Does it hurt?
They're not really that painful. Maybe you just feel a bit hot, that's it, and nothing more than that. But of course, as chemical suggests, you will have some sort of like a downtime with some peeling, and generally if it's medium depth peel, probably about 5 days or up to about 7 days or so.
And how long does it last for once you have one of these treatments, whether the tear trough or any of those types of treatments? How long will it last before you have to have it done again?
With the ever advancing non-surgical procedures, actually they do last longer and longer now. We used to be lips or things like that only last about 4 to 6 months. Now with the latest kind of like technology, it can last 1 year to 1.5 years. So for tear trough treatments, it can generally last more than a year.
One of the things that people will be thinking who are watching at home is, I've heard cosmetic surgery is really expensive, and it's wonderful if you can afford it, but actually it might be out of my price range. Give us an idea. I know it's going to vary from person to person, but give us some idea of what costs are involved here.
Yeah, non-surgical procedures far more cheaper compared to actual surgery itself. Of course, depending on the skills and the locations of the clinic, certainly can be different. But for Botox-wise, you're talking about maybe $250 to $350, maybe run around that price range for about 3 areas. For fillers as well, will be about $350 to $400 plus. That should be roughly the amount. Yeah.
For someone who comes to you for the very first time, maybe that you were talking there in the video about free consultations and things. So let's say somebody comes to you and says, well, I think I might need this, or I think I want this, or I think I want that. Talk me through that initial consultation, what actually would happen.
Yeah, so which is very, very important actually, what you said, because the reason is free consultations for me is pure because sometimes people may need that, sometimes people don't need that as well. And so people may come in with a pre-existing idea, which is good because we need to know what they want so that we can basically explain to them. So when they come in, I will basically listen to what they actually want us to achieve. Is that achievable with non-surgical technique, or does it have to go for surgery? If it's non-surgical, what are the ways we can achieve the same results, and so that they can have a really good idea what they're going into. And so not only just what they want, it's about cause and effect as well, because sometimes people say I don't like the smile line or the nasal labia fold, and they just say I want that to be sorted. But in actual fact, to get that sorted, sometimes what you really need is basically a little bit of volume in the cheek to lift up everything. And then the patients may not know that. So you have to explain to them the reason of the lines because of some descent in the top. So we have to fix that. That will prevent the line from getting worse and also reverse it. And then, of course, if you still bother the person, then we can then just tack along it a little bit more. So a little bit bespoke procedure. Patients have to be involved so that they know what it is, what is that, and then sometimes just so that they wouldn't be like they come in for this procedure, but you're talking completely different procedures. So they have to know the answer, the reason why you're doing this and why you're doing that, why we're doing things in stages, and you have some procedure, and a few weeks later you have another procedure, that kind of thing. And of course, we also always explain to them about the surgical part of it as well, so just so they can have complete informed consent whenever they want to do whether surgical or non-surgical.
We're all looking for that sort of elixir of youth, aren't we? We all want to stay younger. What are the telltale signs for most of us that we are starting to age that we might want to eradicate?
No, it's quite difficult that way, certainly. Of course, when we age, certainly our lines will start forming, and then there's something called malar fat pad, which is underneath our cheek, that will start to slowly descend. When it descends, the eye will basically the line underneath here will look slightly more south, so you may form a tear trough underneath there. And then this excess skin and excess fat pad may then just fold under and then cause a smile line. And similarly on the side, on the jawline, they will slowly go down because of lack of volume, and then they may form some sort of what we call a marinade line. And then the texture of the skin may change, and you may be a bit thinner, may have more pigments on the outside, you may have some lines on the outside. Certainly, there's quite a fair bit. But non-surgical point of view, we don't have to fix things sometimes. So a lot of the time, simply preventative or even maintenance. Of course, there's something that's nothing to do with aging, like we said that before, simply corrections of what happened before as an accident and things like that. And that, of course, is nothing to do with aging, and that just need to be fixed. Yeah.
So coming into the preventative aspects that you were talking there, what are the sort of things that we can do to maybe prolong our youth, if you like, so that maybe we don't need, I'm not trying to do you out of any business here, but other things that we can do to really prolong that youth, so maybe we don't need any treatment for a little bit longer?
Certainly. I would say sunscreen is the most important of all of everything, because the UV light in the sun really cause a lot of damage under our skin. So having a very good SPF, at least 30, if not 50 of sunscreen.
And is that for all skin types? Because sometimes people think, oh, if you've got fair skin, but if you don't have fair skin, you're okay.
Yeah, that goes for every skin type and go for every climate, even in England where we don't have too much sunshine. Even in the winter, you should really have sunscreen as well, because that can really basically reduce the risk of your skin being damaged, and then reduce the risk of some sort of aging process.
And what about the foods that we eat? Are there foods that might age us a little bit more than others? You know, are there foods that might give our skin that little bit more elasticity or anything?
And basically, there are quite a lot of things over the market in terms of like collagen boosters and things like that. But all in all, it's really just very good diet. So you have lots of antioxidants, and those are very, very good for your skin. Hydration is probably more important than anything. So really, you have to make sure you don't get dehydrated. Drink plenty of water. Have lots of fresh fruits and vegetables. Those are actually antioxidants. Is not a myth. They will actually help with your skin. That is why we inject vitamins into the skin. So that's the same reason, same
And of course, it has a knock-on effect of giving you better health generally, because one of the things you mentioned there in the video was about weight loss and about that the stubborn fat, if you like.
Yes.
What sort of things can you do to help reduce the appearance of fat that is less invasive than, you know, having some of these really harsh treatments?
Yes, certainly. So in terms of fat loss or weight loss, certainly exercise and diet are the most important things. But sometimes we do have these stubborn areas that, regardless what you do, they just get so stubborn, so difficult to get rid of. So this local fat, you can, of course, go for surgery, have liposuctions and remove that. Of course, that comes with cost, downtime, and then you need to wear a garment to basically make sure the skin's nice and tight. And alternatively, with non-surgical way, you can have something called aqualix injections, which is a CE marked again, kind of like injections. You can inject it, and then that will dissolve the fat cells, and then your body will slowly take away all the fat underneath within that. And there's also new treatments like a fat freezing cryolipolysis. That's also very, very famous and very, very new. So that basically using temperature, cool the fat down to a very good temperature, and then when it's very, very low, the fat cell would then slowly, they will kind of what we call apoptosis, where they died, slowly over the next couple of months, and then your body will reabsorb all the fat.
The technology you're talking about here is amazing. Would it be correct to say that the need for invasive surgery is actually reduced because of the advancement of this technology?
Yes, definitely, definitely. And non-surgical is so advanced now, and this is actually the directions where all the cosmetics are going. Actually, non-cosmetics is basically the future, I would say. Certainly, you're not saying that there's certain thing you cannot have. Something has to be done surgically, and that's for sure. But non-surgical treatment, there's so many things that we can do nowadays.
What about age? Is there a youngest age that you would look at giving someone some form of facial treatments? And what's the upper end? Because again, I can imagine the body is able to take so much, but at a certain age, maybe that's more challenging.
Certainly. At very young age, certainly, and the younger age, youngest age that we can offer treatments, 18 years old. That's because of legal age. But not just treatment, people when they are in teenagers, they can have just some sort of consultations about general skin health, skin care, face wash, sunscreen, things like that. They can benefit a lot from those. And in their early 20s, they probably more wanted something very subtle, something like a baby Botox or something really, really little, or just a little bit of a light chemical peel just to enhance their look, not doing very much. Of course, when the aging process comes in a little bit more, certainly we can talk about filler to restore the volume, to contour it and things like that. But of course, if it's very mature skin, and then sometimes surgery may be the options that we can give really drastic improvements.
Well, it's been fascinating finding out more so far, and I feel like we've only just began the whole conversation, but we do have to go for a break now, so please don't go anywhere. We'll be right back. Welcome back to The Health Show, where our topic today is facial treatments. Before we talk more with Dr. Tan and hear some patient stories, we're going to take a look at a video which shows medical tourism in South Korea and how it's booming with K-pop fans flocking to the country in the hope that plastic surgery will help them look like their idols.
Amanda travelled all the way from China to get her new look in South Korea. She's having her first consultation with 7 plastic surgeons at this renowned clinic in Seoul, shopping around to choose her new nose, jaws and eyes.
Korean girls, they all have the small face, the vein line. The vein line is pretty, in Asian countries at least, I think.
Like Amanda, thousands of Chinese, Southeast Asian and Japanese patients are choosing to get their plastic surgery in South Korea. Many of them are fans of the Korean pop culture, hoping to look like their idols.
More than half of my patients bring their ideal actor or actress's photos into my office. What's more interesting is that nowadays a lot of my foreign patients are bringing in Korean celebrity photos into my office.
The overall medical spending by foreign visitors hit a record $116 million last year. Out of them, 14% sought plastic surgery or skin treatments such as Botox. Nose jobs, facelifts, jawbone reductions or tummy tucks are popular among Chinese tourists. Thanks to the boom, there are now more than 400 plastic surgery and skin clinics in the affluent Gangnam district. Nguyen An had a nose job in Vietnam 4 years ago, but isn't satisfied.
The silicone that the doctors used in Vietnam wasn't very good. That's why I decided to come to Korea, because I have many friends who have come here for surgery, and they look really beautiful.
The authorities are actively behind the medical tourism boom, easing regulations and helping promote Korean plastic surgery overseas. They hope the country can cash in on the success of K-pop and foreign fans' bid to be beautiful.
That's fascinating watching that video. Have you been aware of this pressure that especially young people are feeling to look like their idols? Are we seeing that in London as well?
Yes, definitely, quite a lot. And I think probably because internet is such a wide thing at the moment, everyone can access Facebook, Instagram, maybe directly with your idols, and that probably gives them a bit of a reason and then a bit of like a boost why they want to chase after that.
One of the concerns for many people, and we saw it slightly in that video there, is that people have gone to one surgeon, not been happy, and they've gone to somebody else instead, which obviously is going to cost them more. Yes. How difficult is it to make sure that you're going to a surgeon who's qualified, who knows what they're doing? What are the sort of questions that a potential patient should be asking?
They need to do a lot of research on the surgeons and also at the clinic, and also pay attention to the price as well. Cheap and not necessarily the best, and probably I will avoid all those hefty discounts or some sort of like a voucher and something like that. And so they need to make sure the surgeons are basically qualified, and they need to go for consultations, have a look, have a chat with the surgeons and the doctors, make sure they're actually doing the jobs properly, have some before and after pictures, quiz them about when's the last time they did the procedures and things like that. Not just online purely, and they have to go in.
Because that is a challenge, isn't it? We've had it here in the UK where people have gone to Eastern Europe, where some, I'm sure, are very good, but some we've seen some pretty terrible stories. For someone who may be in that situation, maybe they have been to a surgery and maybe it hasn't gone according to plan, how challenging is it to fix those mistakes?
It depends. If it's surgery, it can be more difficult because skins or bones have to be shaved and things like that can be more difficult to do. Non-surgical wise, if it's through a hyaluronic acid-based filler, it can be fixed usually quite easily by some sort of like a medicine we call hyaluronidase, which is an enzyme that can be injected and then dissolve all the fillers. So that is also why non-surgical sometimes can be a good option for people, especially for the very first time. So they got the safety net at the back of their mind, saying that if things doesn't really go as well as they plan, there is an option for them to dissolve everything and start again, not just like surgery. Because surgery, if you really do not like it, because it's a surgery, you have to have a revision surgery. And each time when someone do a surgery, the risk, the complications increases purely because the anatomy, the blood vessels area might have different, the scar tissue may have formed.
And the truth of it is, if you just go to a really well-qualified surgeon who's got a great reputation, that's probably the best thing to do.
Definitely.
What about, are there any circumstances where you would turn someone down apart from age? Are there potential side effects? Are there allergies? Or is there anything that would prevent surgery or treatment taking place?
Certainly. So comprehensive history is very important. Sometimes certain diseases forbid them from doing certain procedures, some neurological diseases, sometimes even uncontrolled diabetes, because after all it's still injections, things like that, operations. And allergy reaction is very, very important as well, because you need to know the ingredients of what's been injected or what's been put in, and then you have to know what to do if allergic reaction do come about. So which is why the clinic has to be very very important, and then also be registered. Like over here, we call them CQC. So the clinic is kind of legit. You're not doing it at the back of someone else's room or somewhere if things happened, and they have no way to fix it.
And again, if somebody is undergoing any form of treatment, are there a few basic rules in terms of what they can and can't take in other medications or nutritionally afterwards? Do you go through a whole series of steps to ensure that they do everything right beforehand and after treatment?
Yes. So basically, there's a pre-treatment procedures, the pre-treatment plan. Basically, patients, if you're going for any procedures, ideally is not have anything that make your blood thinner. So like aspirin, ibuprofen, even healthy things like vitamin E, that can basically thin out your blood a little bit more, so make the risk of bruising a little bit higher. And definitely no exercise or alcohol before. For certain procedure, we will usually, depending on different procedure, we usually would then have a post-procedure plan, so things to avoid, like alcohol, exercise, sunbeds, things like that, just to make sure the procedure is, you get the best out of the procedure and reduce the risk of infection.
And how about the follow-up once the procedure has been completed to ensure, A, that your patients are happy with their results, and is there any ongoing follow-up to monitor the future?
Yeah. All my patients have a complimentary 2 weeks follow-up, because sometimes right after procedure, you may have a little bit of bruising, a little bit of swelling, sometimes happen, and that is nothing to do with the procedures being anything wrong, and you simply need time for the fillers and things like that to settle. Something like Botox, that takes 10 days to work, so it doesn't work the very next day. So people may thought, oh, I did that yesterday, how come it didn't work? Which is why 2 weeks is quite good for us, just to come back and just reassess everything so the patient know what it is there anything that we need to take care of or tweak and things like that. That's quite important to have, for the patients to have. So to find a clinic, the patient's quite important for them to find out, do they have some sort of like a follow-up plan they can actually go to.
You talked earlier on about different skin types and things like avoiding sun damage is the same for everybody, irrespective of their skin type. But does your type of skin dictate the way that you receive treatments or the surgery that you can have? Is there any difference in the pigmentation that affects what you do?
Yes, particularly in chemical peel, actually. So for darker pigment, we have something called Fitzpatrick scale. So type 1 is something very, very fair. Type 6 is someone very, very dark. So for people who is much in the darker group, if you burn them with chemical peels, certain chemical peels, you can actually trigger hyperpigmentations of it. So they get more pigment or complications out of the chemical peel. For people who's far more fairer, they actually don't cause too much of issues. So there are treatments that actually you cannot offer for someone who has much darker skin tone, which is why the consultation is very important, because sometimes people come in and say, online or on the YouTube, I saw this chemical peel, it was marvelous, I want this specific treatment. But then you have to educate them and say, actually, yes, it can be very good, but probably not suitable for your skin type, and you have to offer other kind of treatments which is more suitable for the skin type.
All the more reason to go to someone who's qualified, who really knows what they're doing. What about people's confidence? You talked a little bit about that in the earlier video, that it makes a big difference. Give me an example of maybe some people who've come to you, who've had some form of treatment, and it really has given them a massive confidence boost.
Yeah, I can remember really quite a few, but the most common compliment is actually very, very small. It's just something like a nasal bomb. Someone who had it for a very, very long time when we were born or through because of accidents that happened, and then have a small little bomb that they don't really like, and fixing it in about 15 to 30 minutes. And when they looked at it, I have so many, someone just I really want to hug you, you have no idea what you have done, and you have no idea how I wanted this forever. And yeah, that can be very, very encouraging and very, very nice. Yeah.
One slight concern I have is that you hear about people who, you know, we've seen many celebrities who fix one small thing and think, yes, that's great. And then all of a sudden they notice every other blemish that they have and they start on this roller coaster of treatment. What sort of advice do you give to people to keep that into perspective?
Yeah. So usually I would tell them, because for my clinic, my mantra is basically you have to stay as natural as possible. We can have a bit enhancement, but really enhancements to what the natural way, the natural facial features are giving you. So changing completely different features sometimes can be too drastic, and it may not fit the symmetry of certain people or ethnicity or different. So everyone's are different. So which is why it's important to find someone who can be honest with you and said, yes, for facial symmetry, we can enhance it, we can make it better, but it has to be you. You have to know this is still you, it's still very natural. And I don't think it would be worthwhile having something, the nose looks really good, but you know it's completely not your nose, and also it doesn't really go in harmony with the rest of the facial features, and that actually will make it more stand out, and actually it's not a good thing. You want the whole face as a harmony. That's what you really want.
Which is why that initial consultation is so important. I'm going to get really personal now. You've seen all of this happen to many people. You've treated many people. Has that made you look in the mirror and think, well, you know, I just did this for that person, that for that person, you know, I maybe might be tempted to do something myself?
Yes, certainly, of course. And I'm not really resisting any non-surgical treatment or any surgical treatment in the future, but we all have to be very happy on our own skin, and things that you think can be improved, and then you think that actually would make you happy, and knowing that the person you go to are very, very qualified, risk is kept to the minimum, and then things that can be dissolved, things you really don't like, nothing permanent. I think that is the way forward. So that
well, I mean, it's worked for you. I mean, I hear you're 84 years old and you look fantastic.
Thank you very much.
Wouldn't that be great if we
that
could
would
do
be
that?
great, yeah.
Ageing is something that we try to do. There must come a point where you can't actually do any more, that, as you say, it becomes a little unnatural. Have you had certain circumstances where you've actually said to people, you know what, I'm really sorry, we can't help you?
Yes, many, many times. And I would tell them, cheek, for example, you can say, if I elevate the cheek or enhance the cheek, yes, it would take away some wrinkles from your nasolabial fold, but there's only a certain extent when you can do that. When you go over, yes, you don't see the line, but it becomes very unnatural. And then I would then usually tell them, you're trading in something that you may not like, and you most likely would not like. And then when they get the idea, as in, yes, I can turn back time for 2 years, 5 years, 10 years, but if you're asking something like 30, 40 years, and then just with a couple of syringes of filler, even with unlimited syringes of fillers, it's just going to make everything very unnatural. And I know for sure they will not like it.
Now, my production team keep asking me, come on, ask him what he could do for you. So where would you start with somebody of my age? And if I'm thinking, I don't know specifically what I want, but I would like to look a little bit younger. After dyeing my hair, what's next?
But I will go for something non-surgical, certainly. I will go for something very, very small steps first. So you have to get comfortable with the procedure first. I wouldn't go straight away to lots and lots of fillers and lots of different things. I will maybe just some sort of like a very mild chemical peel first, just to freshen up, and then you would then know, okay, I can accept this as part of my regime. It's just basically a deeper cleanser. And
you're being very tactful to say that.
Okay. But of course, you can go for, if you want to venture out something, you can have something like a tiny bit Botox, things like that, if you want to. But for men, it's very, very tricky, because our lines are quite actually define our characters. Men actually, on research, we don't really bother too much by by lines, actually, we don't really see too much of it. We don't really worry
It's a
too
very
much about
unfair
it.
world.
Yeah.
You know, my producer is a woman, and she's always saying, you know, why is it that men seem to be acceptable with lines, and for women it's not? And when we look at the difference between men and women and what they do to their skin, there comes a point in time when you can't do anything, as we've discussed.
Yes.
What's been your biggest success story in terms of the appearance of someone that you've been able to, you know, effectively make them look, what, 1, 2, 3, 4, 5 years younger? How much younger have you made someone look?
It's hard because there's no an objective way of saying that. Certainly, I would say 5 to 8 years would be quite.
So you could
possible.
make me look like I was in my 30s again.
Certainly. That's only 1 year younger.
You hesitated too long there. So seriously for a second, again, people look at this. People could spend an absolute fortune, and maybe their concerns are more to do with their own mental health than with their physical health. How much advice can you give people to make sure they're doing this for the right reasons?
Yes. In medical world, there's something called body dysmorphic syndrome. So basically, when someone has really distorted idea of how they look in front of the mirror, certainly these are the people that actually should not have any surgical procedure or any non-surgical procedures, because whatever that we can provide, they will certainly be dissatisfied with that, and then they will likely to go for more and more and more, and this is actually not to be fixed cosmetically, actually need to be fixed mentally, and so that is quite an important thing. For patients, you have to know the reason you're doing it for. So if you look at the mirror, you think there's something that I really don't like, and then you know that can be fixed, and fixing is just for you, and you yourself will think, actually, I'll be happier to look a little bit like that, and that can be done. And that I would say definitely, but don't do it for someone else. Don't do it for after a big event or some sort like a divorce or something. You want to do it for someone else. You want to do it as don't do it for someone else. That's basically what I'm trying to say.
For you, when you're obviously, as you say, you're fully qualified, you're registered, and you have all of the, if you like, the accreditations that you should have. When someone's coming to someone like you, what sort of guarantees should they be able to get for the work that's being done?
Yeah. So for people who's registered and currently working, are also always going to conference and new training and new things, so that you know they're continuously learning, because cosmetic, non-cosmetic wise, is very much a learning process. What we knew 5 years ago is almost completely redundant now. We have to go up with the technology and the new technique of doing things as well. So for someone who's very qualified, you need to know them. Are they? So what kind of qualifications are they? And also, are they actually currently practicing? And how many patients are they seeing in a day? And even on they're practicing every day, and what that particular procedures you want to do, when's the last time they did that, and how often did that person do that? And of course, you need to have some sort of evidence, like a portfolio of the doctor, like a before and after, so that you know. And also, more important, you need to ask the doctor, as in, what if things goes wrong? Do they know how to fix it? Are they also going to fix it for you? So that is very important, because for filler, a lot of people will worry that if I don't like it, then because it lasts 1.5 years, and then they have to stick with it for 1.5 years. That's actually not true, because you can tweak it, you can dissolve it. There are things you can do to fix it. So which is why the follow-up is important. So you have to make sure the doctors will offer you free follow-up to make sure you are okay. And also, if things goes wrong, then the doctor know how to fix it. If there's some sort of like an emergency, the doctor know how to do it. And the clinic settings actually allow him to do it. So it's not in some place they cannot actually offer.
I'm glad you brought up the emergency side, because we've talked a lot about the cosmetic side, but for a lot of people maybe involved in accidents, we've seen some horrific cases of acid attacks. Have you had any cases in particular where you've really been able to transform someone from some severe scarring or something that's been quite, impactful to their lives?
Yeah.
What sort of stories have you got along those lines?
I have someone who has really, really bad pigmentations on his whole face, really, really bad pigmentations, and basically managed to reduce it. The thing is about pigments is you have to do them in stages. It's not something that you can do completely straight away. And so he's been very patient with me as well. So we do some chemical peels and then we slowly up the chemical peels until a time when the pigmentation is completely gone. And he's so happy. He says, or his family was saying, "Oh, what have you done?" and things like that. And then it really brought him, gave his confidence back. So that was very, very...
Do you get referrals from the NHS, for example, people who have maybe been in accidents or fires?
Yeah.
So does the NHS recommend people to you for treatments to be able to deal with those issues?
Not privately. So NHS do have their own consultants, and it depends because cost involved. They probably will offer more of the surgical procedure rather than a non-surgical procedure where things have to be topped up every 1 year or 2 years. So that may not be the case. So less
of
like
that.
this,
But again, you've been, as you said, you're registered and you've gone through all of the necessary accreditations and so on. If someone's thinking of having some form of treatment, some form of surgery, and they're a little bit unsure, what would you say to them?
I would say do lots of research and don't do the procedure with the first person you see. And you can go back to the same person, but after you have seen the third or the fourth, so that you get a feel of everything, and do check the credential, and not just on the face value on the paper. You can check lots of things online. You can check the GMC registration. Is that definitely active? Is this person really registered with this particular body? And you can check the clinic. Is that registered to CQC, which is quite easy to do. Lots of things are free data information. You can get that from the internet anyway. And then do have a rapport with the doctors, because sometimes so that you can, and the doctor understands you. And then actually when the doctor tells you things, explain things to you, you can understand where he's coming from. Not just, yes, you want this note, you want this celebrity note, yes, you're going to get it. And whether is it going to fit in your face, that is what you wanted anyway. So that is not a responsible doctor. And so you have to, basically don't have to explain to you. And someone who's willing to turn away business. So that is also quite important as well.
I think that's a clear indication, isn't it? If somebody's prepared to turn away business, the chances are they've got the integrity that you need when someone's starting to work on your face or your body. It's been absolutely fascinating. Thank you so much indeed for coming in today. Really amazing. Unfortunately, that's all we have time for today. I would like to thank again Dr. Chia Tan for coming in, giving us such great details and some details of those fascinating treatments he's performed and have helped numerous patients and given them a whole new confidence. If you'd like to find out more about this or any of the subjects we've covered on the show during the series, please do email us at healthshow@islamchannel.tv. And once again, we must stress that should you suffer from any medical problems or have any concerns, then it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health topic being discussed. I really hope you enjoyed the show. We'll be back with more soon, but for now, it's goodbye. Assalamu alaikum.